Hi, I'm Dr. Jennifer McKenzie. I am board certified in family medicine as well as obesity medicine, and I'm going to share 5 things that your family medicine doctor can do that you probably don't know about. Family medicine physicians are often described as generalist or non-specialty physicians. However, family medicine is its own board certified specialty. It just happens to have the widest scope of practice. That means that we go to 4 years of undergraduate college, followed by 4 years of medical school, followed by at least 3 years of residency in family medicine before we can be eligible to become board certified. Now, that is a lot of training, but sometimes doesn't seem like quite enough to cover all the things that family medicine doctors actually do. Many patients don't fully understand what a family physician is and how it differs from the other primary care specialties. For instance, other primary care specialties include internal medicine, obstetrics and gynecology, and pediatrics. However, pediatricians only see kids, internists usually only focus on adults, and OB-GYNs generally only treat women's health concerns. Family medicine actually encompasses all of these other areas of primary care, and it's the only specialty to do so. Many of the things that I do surprise my patients, as they assume they would actually need to see another doctor for those services. I want to share with you the top 5 things that your family medicine doctor is trained to do that you might not know about. So a small disclaimer that though these are all things that family medicine doctors are trained to do and tested on in residency, it doesn't mean that they continue to do these things in their practice today. It is really dependent on your doctor and where they practice that can determine the scope of the care that they provide. So number 1, we see a full age spectrum of patients from birth all the way to geriatrics. So that includes babies and toddlers, adolescents, adults, and elderly patients. We often see generations of families over years and get to be present through many life milestones. I think this is one of the really big selling points for family doctors. It's so rewarding to go through all seasons of life with your patients. Parents don't need to seek out a pediatrician and don't need to worry about switching them over to an internist later. We're really a one-stop shop. 2, we are trained in prenatal care and delivering babies. Though this is a dying breed, we are trained and spend many hours caring for pregnant patients and delivering babies in residency. As the medical field continues to evolve and values patient quantity, it is difficult to arrange schedules around deliveries in the hospital. Especially if you're in a suburban or urban area saturated with OB-GYNs, the likelihood of your family doctor delivering your baby is lower, but if you live in a rural area, it is very common that your family doctor will be delivering your baby. Some residency programs or fellowships also focus on surgical deliveries, and some family docs will also be performing your C-sections. Though I don't deliver babies anymore, I really love to see mom and baby when they are discharged from the hospital. I'm also very proud and confident that in the event of a medical emergency, I have the training to safely deliver a baby. 3, we do women's care, including pap smears for your cervical cancer screening, pelvic exams, STD testing. We treat incontinence. We're trained in many forms of birth control, including placements of IUDs and Nexplanon, so you don't need to see a gynecologist as well. Again, another one-stop shop. If there's something that I'm having difficulty treating or something out of the scope of practice for me, I will definitely refer to an OB-GYN if that's the case. 4, orthopedics and musculoskeletal injuries. Your family doctor should often be your first stop when you're having back pain, knee or shoulder pain, assuming there hasn't been a major trauma or obvious severe injury. Your family doctor is able to diagnose and treat a wide variety of ailments. We order physical therapy, can get x-rays, CTs, or MRIs for diagnosing, and we even do injections. I do injections in knees and shoulders, along with the hand for trigger finger. I do trigger point injections for myofascial pain syndromes and other soft tissue pain, just to name a few. If things don't improve, or I feel it's largely a surgical treatment, I will refer you to an orthopedic surgeon. 5, got skin issues? Guess what? Most patients do at some point. Many patients think they need to see a dermatologist for a yearly skin check or the rash that popped up, but that's not always necessary. Though I do recommend skin checks, this is well within the scope of your family doctor. We perform skin checks, can identify high-risk moles and lesions, biopsy them, or even remove them if needed. We treat a wide variety of conditions such as eczema, psoriasis, skin tags, moles, rosacea, and more. Don't get me wrong, I definitely refer to dermatology for pesky rashes that don't respond to typical treatments or other complex conditions, but for many skin concerns, your family doc has your back. There you have it. Your family doctor can probably do more than you think, and that is just to name a few. If this wasn't enough, here's your shameless plug to see a board-certified family medicine physician. They have a deep knowledge of many conditions through all ages and stages of life, which is unlike any other specialty. They also know when to get you to a specialist. As always, take care of yourself and take care of your health. See you in the next one.